Imagine for a moment a temporary but really profound shift where your a fundamental sense of you seems to just dissolve. Not in a scary way necessarily, but maybe more like a deep reset. We're diving deep today into something called ego dissolution. It's a concept that, well, it stretches from ancient spiritual traditions right up to cutting edge neuroscience today. So, our goal, our mission, if you like, is to really unpack what this enigmatic experience is, how it feels, what's actually happening in your brain, and why understanding it offers such incredible potential for growth, for healing, but also there's some important things to consider, some risks. Honestly, this is one of those topics that's just packed with aha moments. Okay, let's unpack this.
Yeah, it's fascinating, isn't it? How this idea, which sounds pretty radical, losing yourself, is actually woven through centuries of human experience. Mystics, shamans. They knew about this in their own way. And now, finally, modern science is starting to illuminate the mechanisms behind it. So this deep dive, it really offers you a shortcut, a way to grasp not just what ego dissolution is, but why it matters so much for understanding consciousness, well-being.
Right.
We'll start with definitions, yeah. Then trace its history, explore the subjective side, what it feels like. Then we'll look at how it's induced, dive into the brain science, which is just amazing. And finally, touch on the therapeutic uses and, importantly, the ethical dimensions, too.
Okay, so let's start right there. When I use a phrase like ego dissolution, I mean, it sounds pretty intense. What are we actually talking about?
Right.
Is it like completely losing yourself?
That's a great question because, yeah, it does sound intense. But the nuance is key here. Fundamentally, ego dissolution is the temporary disappearance of your usual sense of self. That feeling of being an individual separate from your environment. It's often described as a complete loss of subjective self-identity. That boundary, that clear line between me and not me, it gets fuzzy or even vanishes. You might hear other terms too, like ego death, ego loss, ego disintegration. William James way back called it self-surrender. But the really crucial point, consciousness persists. You're still aware. It's the self-identity part that dissolves. It's not like passing out. It's a radically different kind of awareness.
Right, that distinction is vital. So consciousness remains, but the I changes. So if we're talking about the ego dissolving, where did this idea of the ego even come from in the first place, psychologically speaking?
Well, psychoanalysis really gave us the first clinical language for this. Sigmund Freud, of course, he talked about the id, the superego, and the ego kind of mediating between them. He saw the ego as working on the reality principle, organizing thoughts, helping you function. He called this the secondary process. So from that Freudian angle, ego dissolution can be seen as a temporary slip back, away from that organized, constrained secondary process towards a more fluid, dreamlike state he called the primary process. And here's where it gets really interesting today.
Okay.
There's this striking convergence. Freud's ego functions, particularly that secondary process, they map almost perfectly onto a major brain network, the default mode network, or DMN. We hear a lot about that now. And that fluid primary process. It looks a lot like the increased brain entropy, the sort of global connectivity we see during ego dissolution.
Wow. So like a century ago, Freud was describing something that brain imaging is now starting to actually show us in the neural networks. That's kind of wild.
It really is. The parallels are remarkable. And then you have Carl Jung, also from that psychoanalytic tradition, but with a different take. For Jung, this wasn't about regression or destruction. He saw it more as a psychic death. But in a positive sense, like a necessary reordering of the psyche. A way to move beyond ego limits, face the unconscious, find a more authentic self. But, and this is crucial, Jung also really emphasized the dangers, the risks of forcing this too soon, before the ego is ready. That's a warning that still resonates today. Oh, and briefly, there's Stanislav Grof, too. He even linked ego death experiences to the primal experience of birth, a kind of symbolic reliving of dissolution, struggle, and rebirth.
That's fascinating, seeing these threads across different psychological schools. But let's zoom out for a second. What about philosophy and cognitive science? How do they view this self that can apparently dissolve?
Right, so modern philosophy and cognitive science tend to view the self differently, not as a fixed thing sitting somewhere in the brain, more like a dynamic process, a constructed reality even. And understanding that helps understand how it can dissolve. We often distinguish between the narrative self and the minimal self. This is key. The narrative self is your story, right? Your autobiography, memories, personality, hopes for the future. It's a complex cognitive construct, and that seems to be what's primarily affected what dissolves during ego dissolution. But the minimal self, that raw, immediate sense of being the one having the experience right now, that basic awareness, that usually persists.
Ah, okay. So that explains how you can still be aware of the experience happening, even if the story of who you are fades out.
Exactly, it resolves that paradox. And modern neuroscience often talks about the self as a complex predictive model, almost like a useful Cartesian fiction, as some put it. Its job is basically to integrate information. So ego dissolution, from this perspective, is like the temporary breakdown of that predictive integrative model. It kind of reveals that our normal feeling of having a stable, separate self is an active construction job the brain is doing all the time, not just a passive reality.
Okay, so modern science is giving us these incredible models and insights, but the idea itself, dissolving the self, it isn't new at all, is it? Feels like it goes way, way back to the roots of human spirituality almost.
Oh, absolutely. Deep roots. The intentional pursuit of something like ego death is ancient, and it's cross-cultural. You find it in mystical and shamanistic traditions all over the world, often as a way to connect with the universe or the spirit world or God. Think about Sufism. In Islam, they have the concept of fana. It means annihilation or passing away of the self. It's seen as a necessary step before achieving union with the divine, which they call baka. Or look at Zen Buddhism. The goal of satori, or enlightenment, is fundamentally about realizing the self is illusory, experiencing unity with everything, with Buddha nature, often through intense meditation. Even in Christian mysticism, you have figures like St. Teresa of Avila or Meister Eckhart describing these unitive states, where their individual souls seem to just disappear, leaving only God's presence. Often after going through what they call the dark night of the soul, it sounds like a pretty intense stripping away of the ego.
Right, the Dark Night. And then this ancient experience, this concept of ego death, it got this massive revival, didn't it, in the 20th century?
Yeah.
Especially with psychedelics coming onto the scene.
Precisely. The term ego death really exploded into the popular and scientific vocabulary in the mid-20th century, largely because of psychedelic exploration. People like Timothy Leary, Ralph Metzner, Richard Alpert, their 1964 book, The Psychedelic Experience, was hugely influential. They actually defined ego loss as complete transcendence beyond words, beyond space-time, beyond self. Very evocative. And they framed it as this crucial first step on a spiritual journey, a symbolic death of the old limited ego, making way for a kind of spiritual rebirth. It really captured the imagination.
Okay, so we've got a good handle now on what it is conceptually and its really deep history, but let's get into the experience itself. What's it actually like to go through ego dissolution? Because it sounds like it could be, well, incredibly intense, maybe beautiful, maybe terrifying.
It is intense and highly personal, but the research suggests a kind of common process, often unfolding in stages. First, there's often a phase of dissolution or disintegration. This can feel jarring. Your usual grip on reality starts to loosen. Those familiar self-boundaries feel permeable. There's often a sense of losing control, which can be unsettling. Sensory perception can change dramatically too. You might see vivid geometric patterns or experience things like synesthesia. Then comes the peak, ego loss or ego death. This is where that subjective identity completely dissolves. There's no longer a distinct I experiencing things in the usual way. What's left is often described as just pure awareness or profound sense of unity with the environment, the cosmos, maybe some transcendent reality. Now, this can be overwhelmingly blissful, mystical, like descriptions of nirvana or enlightenment. However, and this is really important, if someone's unprepared or if they fight against it, the same feeling of annihilation can be deeply disturbing, terrifying even. And finally, there's the return and integration phase. Ordinary consciousness, your familiar self, gradually comes back online. But often there's a shift, a fundamentally altered perspective. And this period after the experience, the integration, it's absolutely crucial for making sense of it all, for translating insights into lasting change.
Wow. So it can be blissful, but it can also be absolutely terrifying. That's such a paradox. How can one experience have such wildly different outcomes for people? Is there a secret sauce?
Yeah, it's one of the most striking paradoxes, isn't it? And the key seems to lie in what researchers call set and setting. Your set is basically your internal state, your mindset, expectations, personality, your emotional state going in. And setting is the external environment. Physical, social, cultural context. When the experience is welcome, when someone feels safe and can surrender to it, especially in a supportive setting, it's often described as profoundly liberating, blissful, deeply meaningful, full of unity, oneness, love, sacredness, peace. We actually measure this positive side using scales like mystical experience or oceanic boundlessness. But the flip side, if someone resists it, if they're fearful, unprepared, or in a negative environment, it can become an intensely frightening bad trip, overwhelming anxiety, paranoia, that terrifying loss of control, maybe even feeling like you're going mad or experiencing psychosis. It's almost like the ego's desperate struggle against dissolution turns a potentially transcendent experience into something fragmented and terrifying.
Okay, that makes sense. Set and setting are key. But even with that huge range of emotional responses, are there like common threads, shared
Yeah.
sensations people consistently report, a sort of core phenomenology?
Yes, definitely. Despite the individual variability, several core features pop up again and again across different ways of inducing it. The absolute cardinal feature is the dissolution of the self-world boundary, that breakdown of the distinction between you, the subject, and the world, the object. That just melts away. People also often report body dissolution, feeling disembodied, losing the sense of having a physical body, or feeling like you're merging with the space around you. Then there's often a profound transcendence of time and space. Normal frameworks just dissolve. Time might slow down, speed up, stop, or just vanish. Same with your sense of being in a specific place. And reflecting the narrative self-dissolving, there's the loss of personal history. Temporarily, access to your own life story, your memories, personality, future plans, even your social identity. It just becomes inaccessible. The story of me pauses. And finally, this often leads to non-dual awareness. That subject-object split is gone. There's no I aware of something else, just a unified field of awareness, pure being.
That's a really powerful description. So we know what it feels like. How do people actually get to this state? Is it always through something like psychedelics, or are there other pathways?
Right. The methods seem really different on the surface, but they probably converge on a similar neurobiological pathway.
Mhm.
Essentially, disrupting the brain's usual top-down filtering systems that keep our ordinary sense of self stable. The most, well, rapid and reliable method currently known is pharmacological induction, using psychedelics. High doses of the classic serotonergics, psilocybin, LSD, DMT, ayahuasca are strongly linked to it. And also the dissociative anesthetic ketamine, especially at higher doses. It seems to be pretty dose dependent, and you generally need a higher dose for full dissolution.
Okay, so the chemical route is sort of the fast track. What about non-substance methods? Can you get there without drugs?
Absolutely. And in complete contrast, really. Many contemplative traditions use contemplative induction. This involves intense, disciplined meditative practices, often cultivated over years, even decades. Techniques like focused attention meditation or open monitoring meditation work to kind of de-automatize how your mind works, training it to stop identifying so strongly with self-referential thoughts. Advanced practices like non-dual awareness meditation specifically target that subject-object split. The goal here is usually a much more gradual, controlled softening of the ego's grip rather than a sudden shattering. And then there are physiological and environmental methods too, like holotropic breathwork. This uses rapid, controlled breathing, basically hyperventilation, to induce non-ordinary states, which can include ego dissolution, and things like flotation rest sensory deprivation tanks, floating in dark, quiet, salty water. By drastically cutting sensory input, it can lead to body boundary dissolution, altered time perception, states that overlap a lot with ego dissolution. There's even research showing that the loss of body boundaries in flotation tanks correlates with reduced anxiety.
Interesting. So it's not just deliberate practice or taking something. Can it just
Yeah.
happen spontaneously?
It absolutely can. Ego dissolution isn't always planned. It can occur spontaneously, often triggered by really profound or extreme life events that kind of shatter your normal identity. Near-death experiences, for example, frequently include reports of peace, oneness, loss of self, very similar descriptions. Other triggers could be intense grief, major life transitions, maybe even overwhelming experiences of awe in nature, and of course, various cultural practices, ecstatic dance, trance drumming, sweat lodges. These often aim to induce similar self-transcendent states.
Okay, this is where, for me at least, it gets really fascinating. The brain science. How is our brain doing all this? Is there like an ego spot in the brain that just switches off?
Yeah, that's the million-dollar question, isn't it?
Ugh.
It's definitely more complex than an on-off switch for an ego spot. A lot of the early neuroimaging research focused heavily on the default mode network, the DMN. Think of the DMN key parts are the medial prefrontal cortex, posterior cingulate cortex as the brain's me network. It's most active when you're mind-wandering, thinking about yourself, your past, your future, self-referential thought. So it's been hypothesized as the main neural basis for that narrative self, maybe even the Freudian ego. And what's really consistent across studies psilocybin, LSD, ayahuasca, is that these substances acutely disrupt the DMN.
Disrupt how?
Primarily, they decrease the connectivity within the network. The main hubs of the DMN communicate less with each other. It kind of disintegrates, functionally speaking. And studies show a strong correlation. The more the DMN connectivity decreases, the more intense the reported feeling of ego dissolution. This is also linked to changes in brain waves, particularly a drop in alpha waves in the posterior cingulate cortex, a key DMN hub.
Okay, so the DMN is definitely a key player, but you said it's more complex, not just one switch.
Exactly. It's not just the DMN going quiet, it's more like a whole brain reorganization. Psychedelics don't just turn off the DMN, they seem to reconfigure its role. You often see decreased connectivity within the DMN, but crucially, increased connectivity between the DMN and other networks, like sensory networks. It suggests the brain shifts from its normal, somewhat segregated state, where the DMN is often dominant, to a more integrated, globally connected, maybe even more democratic state.
A more democratic brain. I like that. So what other networks or regions get involved in this symphony of self-dissolution?
Well, besides the DMN, the salience network is important. Its job is to detect what's important or relevant in your environment. Its integrity also seems to decrease during ego dissolution, which could disrupt your normal sense of what's real or significant. And there's this interesting relationship between the DMN and the dorsal attention network, DAN, which focuses on the external world. Normally, they're anti-correlated when one's up, the other's down, like internal focus versus external focus. Under LSD, this anti-correlation weakens. That could be a direct neural correlate of the self-world boundary blurring. And if we zoom in even further, specific nodes are crucial. The hippocampus, vital for autobiographical memory. Positive ego dissolution experiences under psilocybin correlate with decreased glutamate there, maybe making it harder to access your personal story, facilitating that sense of unity. And here's something really fascinating. The thalamus, the brain's main relay station for sensory info. Research suggests it plays a key role. Under psychedelics, there seems to be increased information flow from the thalamus to the cortex. It's like the filters open up, potentially causing a sensory overload that overwhelms the brain's ability to maintain that neat, bounded self.
A sensory overload,
Oh.
okay.
And then you have areas like the dorsolateral prefrontal cortex, DLPFC, involved in executive functions like planning and working memory. Its connectivity with the thalamus and visual areas actually increases during LSD-induced ego dissolution. It might be trying really hard to make sense of this flood of unusual information and perhaps failing, contributing to the dissolution. And finally, the medial temporal lobe, MTL, involved in memory and emotion, shows decreased connectivity with DMN regions too. Again, potentially disrupting that coherent self-narrative.
Wow, okay, that's incredibly complex, a lot of moving parts. So how are scientists trying to tie all this together? Are there overarching theories to explain the why behind these brain changes?
Yes, several powerful models are emerging. One really influential one is the Rebus model that stands for Relaxed Beliefs Under Psychedelics. It views the brain as a kind of prediction machine, organized hierarchically. High-level beliefs, often associated with the DMN, normally constrain or filter incoming sensory data. Rebus proposes that psychedelics relax these high-level beliefs, these priors. This allows much more raw, bottom-up sensory information or prediction error, technically to reach higher levels of processing. This leads to increased brain entropy, more complexity, more unpredictability in brain activity. Subjectively, that feels like a more fluid, less constrained consciousness. Ego dissolution in this model is the extreme end of this. The highest level belief, the self model, is profoundly relaxed. And this opens up this incredible window, potentially, to revise deeply held, maybe even unhelpful beliefs about yourself and the world.
Relaxing beliefs, allowing more data in, that makes intuitive sense.
Right. And building on that, you have predictive processing and self-unbinding frameworks. They emphasize that the self model's job is normally to bind information together into a coherent I. Ego dissolution is seen as a temporary failure of this binding process. The brain can't knit everything together into the usual self-story. It really highlights that our everyday sense of unity isn't just given, it's an active modeling process. The thalamic gating idea fits well here. The system gets overwhelmed. And there's also the brain criticality perspective.
Criticality.
Yeah, the idea that the healthy brain operates near a critical point, a sweet spot between rigid order and total chaos, which is optimal for processing information. A very recent 2025 study using DMT found something interesting. It seemed to shift brain activity away from criticality into a subcritical state. Paradoxically, this subcritical state was actually more entropic, more random, less complexly organized. And crucially, how far the brain shifted into this state directly correlated with how strongly people reported ego dissolution, suggesting it disrupts the brain's fundamental self-organizing dynamics over time.
Okay, so we have these substances, these practices that can induce the state. And we're getting a clearer picture, incredibly complex, but clearer, of what's happening in the brain. So what does this all mean for, well, for helping people, for real-world applications? Can this profound experience actually be therapeutic?
Absolutely. The therapeutic potential is probably the most exciting area right now. Ego dissolution, or the broader category of mystical-type experiences it often falls under, is emerging as a key mediator of the benefits seen in psychedelic-assisted therapy. Take depression, for instance. We know depression often involves DMN hyperactivity, lots of rumination, being stuck in negative self-loops. Ego dissolution scores are often negatively correlated with depression severity after treatment. That DMN disruption might act like a reboot, breaking those rigid patterns, allowing fresh perspectives. Or think about end-of-life anxiety. Studies with psilocybin in terminal cancer patients have shown really large, sustained reductions in anxiety and depression. And those benefits are strongly correlated with the intensity of mystical experience, including ego dissolution. Patients often report feeling a transcendence over death, a connection to something larger, reframing their whole perspective on life and death. It's also showing promise for PTSD and addiction. Loosening those rigid ego defenses might allow for reprocessing trauma differently, or disrupting the self-centered narratives often found in addiction, while fostering feelings of connection that offer an alternative to substance use.
Connection seems key there.
It really does. And this is leading to a more nuanced view. While ego dissolution might be the dramatic trigger, the catalyst that breaks down rigidity, the real lasting healing agent might be the profound state of connectedness that this dissolution makes possible. Connectedness to self, to others, to nature, maybe to something spiritual. If you think about conditions like depression or addiction as fundamentally states of disconnection and isolation.
Then the antidote is connection.
Exactly. So ego dissolution creates this window of opportunity, this plasticity. But it's the feelings of love, unity, and interconnectedness within that window and how they're integrated afterwards that seem to drive lasting change. This really emphasizes the clinical focus needed not just on surrender during the experience, but actively cultivating that sense of connection during integration. And the long-term outcomes reported are pretty remarkable too. Lasting personality changes, for example. People often show decreases in neuroticism and increases in openness to experience things like curiosity, creativity. Sometimes increases in extroversion and conscientiousness too, and meaning. Participants in these studies consistently rank these experiences as among the most personally meaningful and spiritually significant of their entire lives, comparable to the birth of a child or the death of a parent. And this is often associated with sustained increases in life satisfaction, optimism, and overall psychological well-being months or even years later.
Wow. That sounds incredibly promising, but something this powerful has to have a downside, right? What's the dark side of dissolution? What are the risks we need to be aware of?
Absolutely critical question. Because yes, while it can be profoundly healing, the ego is, a necessary structure for daily life. It protects us. And forcing its dismantling too quickly, especially chemically, can be really destabilizing. This echoes Jung's critique we mentioned earlier, the danger of premature destruction. The ego helps manage difficult unconscious stuff. If you blast it away suddenly, you can get flooded with overwhelming shadow material, fear, shame, grief, trauma. And without the capacity or support to process that flood, it can lead to severe anxiety, paranoia, just being completely overwhelmed emotionally. There's also the risk of spiritual bypassing, mistaking that temporary feeling of oneness for permanent enlightenment.
Right, thinking you're suddenly done with personal work.
It's exactly. Leading to maybe spiritual superiority, avoiding the messy work of emotional integration, maybe even detaching from everyday life and relationships in an unhealthy way. And in some cases, stripping the ego too fast can leave someone feeling totally unmoored, lost, unsure of who they are or what's real. For vulnerable individuals, this can potentially trigger prolonged dissociation, depersonalization, or even, in rare cases, manic or psychotic episodes.
And that brings us back to the bad trip.
Yes, that negative pull. The experience of painful isolation, profound estrangement, maybe psychosis like terror. Some assessment tools now specifically distinguish between positive unity experiences and these negative ego loss or anxious ego dissolution experiences. And we know some factors increase the risk, things like a pre-existing tendency toward dissociation, certain personality traits, maybe even things like recent sleep disruptions.
Okay, this brings up a really important clinical point. How do therapists or researchers tell the difference between a profound, maybe difficult, but ultimately therapeutic ego dissolution and something that's actually a serious clinical issue, like emerging psychosis or a depersonalization disorder? They sound like they could look similar from the outside sometimes.
That is a crucial challenge and requires careful assessment. The key differences often lie in the context, the duration, the overall emotional tone, and critically, the person's insight. Let's try to break it down. With ego dissolution, the positive unitive kind, the core feeling is unity, connection. But importantly, insight is retained. Afterwards, the person knows it was a profound experience, maybe a glimpse of deeper reality, but an experience nonetheless. It feels overwhelmingly positive, expansive. It's acute, temporary. With ego dissolution, the negative fragmented kind, core feeling is fragmentation, isolation, maybe terror. Still, insight is usually retained, especially afterwards. They know it was a drug effect or an altered state, even if it was terrifying. Overwhelmingly negative feeling of disconnection. Again, acute, temporary. Now compare that to depersonalization, derealization disorder. Here, the feeling is detachment, unreality, being foggy, numb. But insight is intact. They know the feeling of unreality isn't objectively real, it just feels that way. It's distressing, but they know it's a subjective feeling. And crucially, it's persistent or recurrent, not just a brief state. And finally, psychosis. This involves a genuine loss of contact with reality. Delusions, hallucinations. Here, insight is impaired. The person believes the delusions are real. Emotional tone can vary wildly, and it can be acute or become chronic. Social withdrawal is common. Understanding these distinctions, especially around insight and duration, is absolutely vital for safe practice.
That's a really helpful breakdown. So, given this incredible potential, but also these significant risks, how do we ensure this is used safely, effectively?
Yeah.
Especially as psychedelic therapy becomes more mainstream.
It absolutely requires a robust, thoughtful, ethical framework.
Yeah.
And skilled facilitation. There's that paradox again. The experience itself often requires deep surrender, letting go. But lasting change needs conscious effort, integration, taking agency back. The therapist's role is crucial in guiding that whole arc, from preparation through the experience and especially into integration. The critical role of preparation can't be overstated. We talked about set and setting. Therapeutic prep focuses on optimizing both, educating the patient, helping them set clear intentions, discussing strategies for navigating difficult moments, especially how to lean in, how to surrender rather than resist. And the therapeutic alliance, that trusting relationship with the therapist, is paramount for feeling safe enough to let go.
And then after the experience.
Then comes integration. This is where the real work often happens. The experience itself might open doors, increase brain plasticity. People talk about an afterglow period. But change happens when those insights are woven into life. Integration involves helping the person make sense of what was often an ineffable experience, identifying key insights, connecting them to life challenges or goals, and crucially, translating those insights into concrete behavioral changes, new coping skills, maybe a revised life story, often using tools from traditional therapy. And of course, there are major ethical and legal frameworks needed, especially as this moves into clinical practice. Clinicians face risks, malpractice, licensing issues, even criminal charges where substances are illegal. So risk mitigation is huge. Things like really comprehensive informed consent detailing the unique psychological risks, meticulous documentation, data privacy, and absolutely critical, specialized competency and training for therapists working in this area, plus ongoing supervision and consultation. It's not something to be taken lightly. So if we got to tie this all together, this deep dive into ego dissolution, it really reveals something profound. That the ego, our sense of self, isn't this fixed thing to be protected or destroyed. It's a dynamic, malleable process the brain is constantly running. The experience of ego dissolution is like a temporary, reversible pause in that process. And it shows us quite dramatically that our everyday feeling of being a separate self is a cognitive construction, a useful one usually, but not an immutable reality. And the way ancient mystical reports are now converging with modern neuroscience, it points towards this fundamental human potential for self-transcendence. With biological roots, we're finally beginning to understand.
What a journey, seriously. From ancient mystics looking inward to these incredibly detailed modern brain scans, it really underscores that the so-called death of the ego isn't necessarily an end. For many, it seems to be a powerful beginning, a transformation. It's just a profound reminder, isn't it, of how adaptable our minds really are, how much more there is to learn about ourselves, about consciousness itself. So the final thought maybe for you listening, what does this all mean for you? If your sense of self truly is this dynamic construction, what kind of self are you actively building right now, moment by moment? And what surprising new possibilities might emerge if you really grasp its malleable nature? Is there maybe a part of your own narrative self that you might be ready to gently, even temporarily let go of, just to make space for something new? Lots to think about. Thanks for diving deep with us today.